Could you please welcome Jade Swan from Psychiatric Australia. And so you're going to talk about the Back on Track project. What's that? And I did give her 2 lucky door prize numbers because she's heavily pregnant.
Thank you. Yeah, I'm here to talk about PRA's Back on Track Health program, which officially rolled out last year in 2010. We don't have fancy iPhone apps, but we do have some practical physical health resources that we have tailored to support individuals who use our service to identify if they're at risk of any serious physical health conditions.
So is that the goal, to identify if you've got a problem and then take action? Is that the goal of it?
Yeah, one of the main purposes of the program is, it was obvious that consumers who use the service, like many of us here today, didn't realise the extent to which the mental illness and the treatments that they are receiving affects their physical health. So we wanted to create awareness among consumers that use PRA services for a start. And one of the ways we do that is to regularly, every 6 months, offer an opportunity for that person to reflect on aspects of their physical health that they may not have considered previously.
And what sort of tools do you give?
Janet's got some here, actually.
Thank you.
We have examples of the samples that have been taken, but I mean, I'd love to talk to people about how they can get more information about the resources if they kindly return them. I didn't bring enough to share around, so I'd be happy to catch up with people individually and tell you how to get involved. We have the My Green book, which is an adaptation of the Red book, which people may be familiar with. We ran, I suppose one of the key parts of our program is consumer involvement, and all of the resources that have been developed have been developed in consultation with PRA consumers. So what you see is a direct result of what consumers have said is important to them to include. So we ripped apart existing resources that are available, and what we put together was something that is hopefully more user-friendly. So this green book helps people to keep track of appointments, of the range of medications that they may be taking. They can put that in one place. It's a place to house prescriptions or information that they've received from whichever health professional they're seeing. A really key part of the program, and people have talked about not knowing what to do to maintain their health, and it was really important for our program to be supporting people who maybe don't know that they're at risk of a physical health need, all the way through to those people who are managing a range of physical health needs. So we've got resources that can support people at any stage in terms of their self-management, and these are for people to take themselves. PRA doesn't keep these documents or anything. This is for the person to take to their GP or other relevant health appointments. And we also have the My Health Needs checklist. I did have some samples which only yesterday have been put through a consumer-led focus group to get more feedback. So this essentially is every 6 months people are offered the opportunity to inquire further about their health. Every 6 months we do offer the Kansas, which I know Nicole, that Nimai's organisation also offers that summary, and people can identify if they're at risk of physical health needs through that existing process.
So it's a series of self-management, self-empowerment tools to help the consumer directly identify their physical health needs and manage it and communicate with professionals. Is that the nub of it?
Yeah, it's individualised, which we've all heard today is so important. So we don't give a whole range of written materials about how you can improve your health. With support, people are provided with a checklist. If they've identified an unmet health need in the Kansas, we can then supply that person with an opportunity to ask themselves through the checklist other questions that they may not have considered before, like, do you have a dry cough with phlegm? Do you have trouble getting to the toilet on time? Would you like to have or receive more physical contact than what you do now? Are you satisfied with the sexual relationships that you have? Important questions that previously were ignored. And we've provided, obviously, support for staff as well to be able to have these conversations too. They're not the conversations that traditionally people have been having. So every 6 months we provide that opportunity for the person to, I suppose, take control of their health. Yeah. And
Jade, I'm afraid I'm going to have to finish. Is there one last thing you'd like to say?
Well, we'll take the opportunity. I'll be over at the back at lunchtime to have a chat with people in more detail, because the program is coming along really well, and there's some really practical things that organisations can be doing. It's a really exciting time, so please come and see me. And those people that took the samples, I think that's really encouraging, and I can't wait to receive them back. But I'll get your name and I'll say, oh, thank you. Yeah,
some people have taken them by mistake, but they'll return them now.
Yeah, and I'll have a chat with you about and how you can get involved. But I think it's a good sign if people take them.
Yeah, no, they're clearly attractive.
Yeah.
Would you give her a round of applause?